you've got questions, well, we have the man to answer those questions, Jeffrey Levine from Buckingham. Jeffrey, welcome back to another episode of Ask the Antique Hammer.
It's good to be with you. I'm gonna get a little, you're gonna filter, gonna sepia tone me for the next one.
All right, as you might imagine, I've got questions in my inbox. One goes like this: company insurance for myself and spouse, HSA in 2023 for $150 a month or $1,800 total. Based on my phone call to Social Security, I am ineligible for the HSA as of July 1. The 1,800 is well below the 1/2 year amount of family coverage. Am I okay, or does it matter that the payments for $150 a month were made in July through December?
Yeah, great question. So just to summarize this question for those listening, the issue here revolves around the fact that you cannot contribute to an HSA account once you are enrolled in Medicare. You can't have other non-qualifying coverage, and Medicare would be one of those types of non-qualifying coverage, as would something like a full service flexible spending account for the healthcare side would be another no-no, if you will. But the issue is Medicare is a big one because people go on Medicare typically at 65 if they're working for, or rather if they're retired or they're working for a small employer. That's going to have to be the case no matter what. So, well, at least to avoid penalties, I should say. I guess you don't have to do it, but it would not be a good move to not do that. So the issue becomes, when do you need to stop contributing? And if you're starting to enroll at 65, it's usually pretty straightforward, but there is something called a 6-month look-back period, which impacts those who file later. Notably, if you file for Social Security benefits, which automatically enrolls you into Medicare, or you just apply for Medicare sometime after you're 65, Part A is actually it automatically starts retroactively 6 months before, as far back as your 65th birthday. So if you're 65 and 3 months old when you apply, Part A would go back only 3 months, because only to your 65th birthday at the earliest. But if you were 70, you'd actually start at 69 and a half, which means at that point you can no longer contribute. So here's the deal. When we're looking at how much you can contribute, the idea of when during the year you do it is not really that important. We say you can't contribute after this time. It just means those months you were ineligible, and we can't add those totals up as part of your maximum HSA contribution limit for the year. But let's say the HSA contribution limit for a family this year is a hypothetical $8,000, and you're eligible for half the year, means you can put in up to $4,000 into your HSA for that year. And not only can you do it after you've gone on Medicare, let's say your 65th birthday in this particular individual's case, but you can do it up until April 15th of the following year. Just means you wouldn't be able to make the full, in our example, $8,000 contribution for that year.
Right. And I think people also wonder about what's the penalty if I continue to invest in my HSA after that deadline.
Yeah, so that becomes an excess contribution penalty. It's excess contribution, rather. It's subject to excess contribution penalties until it's removed. So you want to avoid those sorts of issues. We want to make sure that only the money that's supposed to go in there goes in, and anything that does not go in there. The biggest issue by far is this retirement issue for those who are switching from a high deductible health plan to Medicare. And that's a significant number of people, because today about 50% of workers have the ability to contribute to an HSA based on their health insurance plan.
Right. And I suppose one complication comes into effect when a spouse is working, is making contributions to a family HSA, and the spouse is the one that's going on Medicare. That's right. Is that where sort of the big problem?
That's like taking it to an even more complicated level. Absolutely, because the HSA contribution limit is based on the type of coverage you have. So let's say I'm working, but my wife has retired, and my wife is covered both by my HSA eligible health plan and Medicare. Well, she cannot contribute to an HSA because she is on Medicare. But I am not on Medicare. And if I have a plan that covers me and my wife, even though she can't contribute, My plan is family coverage, which means I can still contribute up to the family maximum. This is one of those really complicated areas, Bob, where we see lots of mistakes each year, people not realizing when they should enroll and how much their continued contribution eligibility is. And not surprisingly enough, this is one of the most popular questions we see in our inbox on a regular basis.
It's popular, and you've done a great job of uncomplicating the complicated. So thank you.
Well, thank you for that question. And send us some more. Deposit some of those questions into our question account. You can do so by giving us a shout at Ask the Hammer. That's ASK, Ask the Hammer at buckinghamgroup.com. Again, Ask the Hammer at buckinghamgroup.com. And we look forward to seeing your questions in our inbox real soon.